They are usually sharply demarcated. Usually sharply demarcated. So if they are sharply demarcated, if they are painful, if there is a fever, I am talking about skin disorders. Let me quickly revise what we have learned till now. So if you can see, we have started with the importance of the skin disorders, why it is important, why it is easy to diagnose as well as difficult to diagnose. We have gone through the classification of the skin disorders like bacterial infection, viral, fungal, parasitic, pigment disorders, etc. We have gone through an examples of the bacterial disorders, and we have gone through the features which will make you understand. If it is a bacterial infection, it will be acute in nature, more common in children in the young age, local temperature will be raised, fever will be there, painful, and also it will be sharply demarcated. Sharply demarcated. Remember, there is a dictum in medicine, they always say, it is the bacterial infection, always try to localize, and a viral infection always tries to generalize. Usually, again, it is again 80-20 rule. It is again an 80-20 rule. So if these are the features of any bacterial infection, it may be, I am not saying it may be a bacterial infection. Possibility is 80-20. It is not like this, if it is painful, it is always bacterial. But 80% times it can be bacterial. It can be bacterial. So this is what becomes a summary of a bacterial infection. Of course, for the treatment, we are going to go through the details of the treatment in the slides. This means we give an antibiotic. What is the treatment we give? Is an antibiotic. Which antibiotic? That is all things we are going to cover in the slides. All things we are going to cover in the slides. Let's come to the viral part of this. Let's come to viral. What are the examples? Everyone knows we have, for example, we have herpes simplex, or I can say herpes genitalis, type of an STD. We also have herpes zoster. We also have, let's say, chicken pox. We also have measles. All those becomes a skin viral infection. Skin viral infections. First of all, so if the patient comes to you with some lesion, how do you know it is a viral one? How do you know it is a viral one? First important feature, it is also acute in nature. In fact, it is super acute. In the sense, till yesterday it was nothing, and today it was full, all over body the skin infection has been, the viral infection has been spread. Super acute in nature. Now this was an acute. Now this is, let's say the common. We also have more common in children. Like for example, we have chicken pox, measles, more common in children, as well as young population. Third important feature is what happens to the constitutional symptoms. What happens to constitutional symptom? That means body ache, fever. It is much more. Even high grade fever. It is severe body ache. So all those things are much more compared to bacterial. Fourth important feature is how exactly the lesion look like. It is spreading rapidly. That is what is the first thing you must understand. Spreading rapidly, much more. Like for example, yesterday it was a small patch, today it is 10 times more. Fifth important point is the lesion usually has got vesicles which is filled with clear fluid. most of the time. I'm not talking about again 80-20 rule. It is a vesicle which is filled up with a clear fluid. It is a clear fluid. Sixth important point, and that is what can be the most important point in this, will be the symptom. It will be a burning sensation. So in bacterial it was a pain factor. In viral it is a burning sensation. In viral it is a burning sensation. Burning sensation. Of course, the treatment was they given antiviral drugs, either a local or a systemic. Either a local or systemic. You can see the PDF is getting created, and I'm going to send it to you for your quick reference. This is what becomes the quick summary or revision through the complete book. For a general practitioner, those who already are practicing in dermatology, is going to help them a little bit more. It's going to help them a little bit more. It's going to help them a little bit more. So that is what is going to help them. So that is what becomes a summary of the viral infections. Summary of viral infections. Summary of the viral infection. Let's come to the fungal infections. What are the examples? All of you know it can affect the skin as well as mucosa. Skin as well as mucosa. The most common organism which is infecting the skin, all of us know, is a dermatophytes. There is a topical skin infection. Like you all must have heard about tinea, cruris, corporis, pedis, as well as you have tinea of the nail, tinea unguinum. You also have tinea versicolor. All those are the superficial dermatophytes which are producing. And mucosa, we have the candida albicans. Candida albicans. So let's come to the features. Dermatophytes. How exactly we are going to identify them? First, are they acute or chronic? They are acute as well as recurrent. One most important feature we must understand, if there is some lesion coming up repeatedly, it may be a fungal. I am not saying it is always a fungal, but it may be a fungal, recurrent in nature first. Second important point is the specific location. This is one of the very important point about the fungal infection. Specific location. Matlab kya? What exactly does it mean? That means it is more common into locations which are having more moisture. More moisture, because fungus cannot grow without water. So it is more common in those locations which has got more water, which are more watery. Like for example, we have scalp. Like for example, we have neck. Like for example, we have a trunk, groins. We have in between the toenails. We have under the breast, over the abdomen. Again in the vagina, because all these places we have moisture. So if you have some lesion in these locations, it may be fungal. I am not saying 100% again, maybe. The reason behind maybe is again, in these locations the bacterial infections can also be there, and especially if it is recurrent, then you may think about a fungal infection more common. Coming to the next feature, what was the point? This was about the second point. Let's say third point, particular point. Do we have any constitutional symptoms? No. That means no fever, no body ache, or anything else. No fever, no body ache. Fifth important point is what is the clinical feature. It is most important feature is an itching. So no pain, no burning. Main feature is an itching in nature. And one important thing you must understand is this itching can be controlled, or I can also say postponed. Let's say, for example, you are there sitting on the stage and everyone is looking at you, and if you have itching, you can postpone it. This is an important feature because there is one type of itching which cannot be postponed. That is what can be the next particular disorder. I am not saying it doesn't burn. See how exactly people do take the words the way it is. For example, if somebody has got a fungal infection and keeps on itching over there, scratching over there, because of continuous itching, it will start burning now. So don't take the words otherwise. So primary symptom is itching, but if you keep on itching over there, skin gets burned because of an itching, or physical trauma occurs because of the forceful or repeated itching, and that way it can start burning again. So here in this case, it is more common in which season? It is more common in summer season because of the sweat. It is more common in whom? It is more common in obese people because they sweat more. It is also more common in diabetic. So obese, it is more common in obese. It is more common in diabetic. Those people. It is also more common in those who are taking steroids, immunocompromised, or can also be more common in these people. So of course the treatment for these will be completely different. Treatment will be antifungals, and we're going to discuss which antifungal, oral or topical, or maybe in the powder form, or which are the other forms. So if you can see, these are the features will be for a fungal infection. Let's come to parasitic ones. So which are the common parasitic infection? Few most important parasitic infection you must not forget is, I can say these days, if you are working in a small village or maybe in a slum, we have a scabies, and we also have the louse. Most important thing you must understand about the scabies. Louse these days not there. Everyone is using that good shampoos and good hygiene and all those things. Scabies is one of the most important problem in underdeveloped areas. It is in slums, in overcrowded locations. Again, it is very common, scabies. So, but what are the features? What are the type of skin lesions patient will come to you with? Skin lesions kaisa rahega? For example, in bacterial we understood something else, viral we understood something else, fungal we understood something else. So, how exactly the lesion will look like? First, it can be a papular, or it can be a vesicular, or it can also be the nodular, because here we have a variety. It can be like a papule, it can be a vesicle. Vesicle is a clear fluid. Clear fluid filled lesion is a vesicle, or it can also be the nodular. Second, location, where exactly these lesions will be. It is more common in the groins, external genitalia. It is more common in the web spaces of the hand, or I can say palm and toes. So web spaces of, and third important thing, it is highly contagious. So you will always have similar patients in the family, highly contagious. You will not see bacterial infections, viral infection, fungal infections in highly contagious. That is, in one family, 3 people are having the same problem. But scabies, highly contagious, at least in the same age group. If some family has got 5 children, if one of them has got scabies, all 5 will have it in a month or 2. It's highly contagious. So we have a similar cases in the family. If you have these similar cases in the family, think about it. It can be scabies. The possibility that it can be scabies. Fourth important point is how are the vesicles? Because vesicles were also there in viral. Viral means also we have clear fluid. Here also we have a clear fluid. But remember, these vesicles having a thick wall. That means it cannot be ruptured that easily. They are having thick wall. They cannot be ruptured that easily. That is what is one peculiarity about the vesicles of the scabies. Fifth and foremost, the most important point is extreme itching, which cannot be controlled or cannot be postponed. This is what is the difference between this and a fungal infection. Fungal infection itching can be postponed. The scabies itching cannot be postponed, cannot be controlled. It is an extreme itching, especially in the night, because the behavior of the parasite, it digs the tunnel, lays the eggs over there in the night, and that produces the allergic response. This becomes an extreme itching. For this again treatment, antiviral is not going to work, antibacterial is not going to work, antifungal is not going to work, nothing is going to work. So in this case we give a special medicine called an anti-scabies medicine. Anti-scabies medicine. We are going to go through what are those medicines, but today I am going to just talk about an eagle's view, or maybe in summary, how to identify skin disorders. How to identify skin disorders. Skin disorders, like we also have pigment disorders. Let's take pigment. Of course, there are few pigment disorders which are important. We can have an hyperpigmentation, and we can have an hypopigmentation. Hyperpigmentation, you all must know there is something called as an chloasma or darkness under the eyes or some part of the skin which is hyperpigmented. Or we can also have moles, nevi, or the natural hyperpigmented spots. Hypopigmented spots, that is what can be a possibility. There is something called as the albinism, something called a vitiligo, something called as an, you must have heard about leukoderma, or can also be the natural hypopigmented areas. Can also have a leprosy, can have an hypopigmented areas. So every one of these has got their own differential diagnosis. In all these disorders, now are they acute or chronic? Most of them are, I can say all of them are chronic in nature. We will not say patient coming to you कि कल तक कुछ नहीं था आज एकदम सफेद हो गया, for example. That is not possible most of the time. Chronic in nature. And most of the lesions, I am talking about this pigment disorders, they don't have any local symptom apart from the color change. Patient will not come to you if it is itching or painful, or it is also, if it is growing, it is very slowly growing. Growth is also very slow. And It has got a specific treatment. I'm not going to go through right now. We have the presentation which includes all those things. Then we have, of course, the paper is going more horizontally. Let's say it here. We have allergic disorders. We have the allergic disorders. Now, allergic in the sense, this is what is producing allergy because of something. The most common disorder in this, you all must know, is an acute allergic disorder, commonly also called as a contact dermatitis. Commonly also called as a contact dermatitis. So what exactly is contact dermatitis? Contact dermatitis means that it is because of some contact with some substance. It is because of contact with some substance. It can be the soap that you are using. It can be the water. It can be a chemical in your creams. It can be the allergic reaction to something that you have, for example, perfumes. Or it can be ornament. You are using anything which comes in contact with produces an allergic reaction. That is what is contact dermatitis. Whereas allergic response to the skin can also be because of some drug, some chemical, or it can also be because of some food. Now, if it is because of the contact, what is the difference? If it is because of some contact, this one has got only local reaction. Only a local reaction. Whereas if it is because of drug, chemical or food, it is a generalized reaction. Like for example, all of you must have experienced that somebody has got some allergy to the food item. Whenever he has that food, all over the body there is some reaction on the skin. So, how exactly the lesion look like? Of course, these are all acute in nature. Either they are local because of some substance or because of generalized. Patient gives history of ingestion or local application of some substance. Patient will always say कि मैं जब भी ये खाता हूँ ये मुझे होता है, and it is recurrent of the same substance. Like for example, if somebody is allergic to some peculiar soap, patient is, whenever she applies that soap, patient has got some allergic reaction. Or some food item, let's say for example eggs, like for example sometimes brinjal or some Chinese food. So if somebody has that, then patient develops the allergic reaction, and it is always acute. And how would the lesion look like? Lesion look like in the skin, it is an elevated macule. Macule in the sense it is a flat elevated skin lesion, and the prominent feature is itching and burning together. Prominent symptom is itching and burning. No constitutional symptoms. No fever, no body ache, and patient gives an history of ingestion or application of the substance without any constitutional symptoms, and it is also rapidly growing. Patient can also have history of similar allergies in the family. History of similar allergy in the family members, that can be a possibility. Here we don't give any local application creams unless it is in contact dermatitis. In that we can give local application steroids creams. We usually give injectable anti-allergic drugs. And which one? That, and also we have steroids. Now which steroid, which anti-allergic, that we are going to take during the proper session and during the your PPT session, or maybe the picture session, images session rather. So this becomes the allergic disorder. This becomes the allergic disorder. Can also have a very commonly, let's go to the autoimmune one, the long way journey for her. Also have the autoimmune. You also have the autoimmune disorders. Again, they are very common in dermatology. One of the most important things that you must know is psoriasis. You also have dermatitis. There are various disorders which are autoimmune in nature. What can be the peculiarities? First, recurrent, and most importantly, most stubborn, in the sense doesn't respond to the treatment. Most of them doesn't respond to the treatment. Most stubborn. Second, the lesion will make skin more thick. Now this is very important feature. Thickness of the skin increases. It is a thickness of the skin increase. This is because of the chronic inflammatory response. Thickness of the skin increases. Skin becomes more or less hard in these locations. Third important thing, it is itching, but very slightly. Compared to the fungal, it is very less. Burning will not be there, pain will not be there. Fourth important thing, it can be there in the similar areas of the other side also, commonly also called as symmetrical lesions. Let's say, for example, extensor aspect of the forearm, the right side and the left side. For example, extensor aspect of the forearm, right and left side, both sides can be affected. Similar area. I am not saying it should be there, but it may be there. It may be there. It may be there. Fifth important point, it is always long term. Patient has got long history, because we cannot cure this disorder. We can only suppress them. Or there may also be a family history. May also be a family history. Common age group, usually a young population, especially in after 20s to 40s, more commonly getting affected. Eighth important point, they can also have a systemic involvement. That means systems can also be involved. Systems can also be involved. Like for example, respiratory system can be involved, GI tract can be involved with some disorder. Here, this requires a complicated treatment. We require the steroids, we require an immunomodulators, we require an anti-cancer drugs also sometimes. So this becomes a complete separate lecture. Completely a separate lecture. What was remaining right now is, let's say for example, of course, where are we? Okay, we have cancer, skin cancers. So we have, let's say for example, skin cancers. Of course, very rare. We have three types of cancer you should know. We have squamous cell carcinoma, we have a basal cell carcinoma, and we have a melanoma. All of those has got their separate similar features, and they are in the form of a nodule, or in the form of an ulcer, or in the form of a pigmentation. They are always there on those areas of the body which are exposed to by sunlight, because the UV light plays a most important role in the etiology of skin cancers. So if you can see how the table has been created, and this will be given to you today so that you can keep it for your reference. So if you can see, we have started with, let me have a summary, and then I can go to a question answer session if you have any. If you can see, we have started with the, we started with the bacterial ones, These are the features. Then viral, then we have a fungal, then we have a parasitic, then we have a pigment disorders, then we have an allergic disorders, autoimmune disorders, and cancers, and then we also have some of the miscellaneous, the other disorders. So what I'll do right now, I'll just keep the question answer session on.
Started.
Okay. If you have any doubt, you can just raise your hand. Okay. Fine. Let me come to one by one. Yes, Prerna. Yes, can you hear me?
Started.
Okay. Ray, what is the doubt you have? Can you hear me, Ray? Yes. Riddhi, can you hear me? Yes. Riddhi, can you hear me? Screen है? Huh? Okay. Okay, let me come to the doubts if you have. Riddhi, can you hear me? Dr. Manjusha?
I can.
Yes. Can you hear me?
So, but I cannot see the slides at all.
The slides I have not shown only.
Okay.
Today we had only whiteboard session. Whiteboard could you see, right?
Yeah.
Okay, fine. Slides I have not shown only. Okay. Yes, Mariam?
Hello.
Yes, Mariam, can you hear me?
Yes, sir.
I wanted to ask a question.
Okay.
You said about dermatitis. Can you explain?
Yeah, we will do that.
Explain it again.
We will do the details of the dermatophytes in the slides. Today this was only a quick summary about what are the clinical features of these skin disorders, all the types of skin disorders. So dermatophytes, I'm showing you all the slides in the next few lectures. That time you'll be able to understand that properly.
Okay, thank you, sir.
Thank you, sir.
Yeah. Yes, Swati, can you hear me?
Ask your question.
Ask your question. Ask your question. Ask your question.
Okay. Chalo, theek hai. I think more questions are there.
Over.
Yes. Let's plan for the slide presentation from Wednesday so that we can understand things properly. Thank you.